Hello, and welcome to The Buzz, where we bring you leaders in dental education discussing hot topic courses and industry trends. I'm your founder of Dental Speakers Bureau, Vanessa Emerson, and I'm very excited to be here today with Dr. Gary Sherman. Welcome to our program, Gary.
Well, thank you. It's a pleasure to be here. Thank you, Vanessa.
Thank you. Now, Dr. Sherman was both a dentist for 36 years and a heart failure patient for 22 years. This has given him a unique perspective on how today's healthcare provider and professionals must relate to and understand his or her patients. I've asked Dr. Sherman to talk with us today about his program that's called What We Must Know About the Dental Heart Disease Relationship Today. As it's a compelling title, and would love to learn more about what you cover in that course, Gary. So maybe you could start us off by helping us understand what's happening for the dental professional, what's happening in their professional world that would require this course to help them solve a problem. What is the challenge they're finding?
Well, throughout my career, Vanessa, it's always been a challenge for most dentists to keep their practices going in a way that they have enough patients coming in, new patients, and also have a great reputation in their community. And so we've tried different things. We've tried direct mail, we've tried social media platforms, and we try all these things to generate more patients. And truly what I found out by being a patient for so long is that the more successful dentists as far as getting more patients are the ones who are creating relationships with their patients. And by creating relationships, it's just taking the time to speak to their patients and get the information that they need to properly treat them and show them that they care about them. And it's as simple as that.
That's interesting. So what we're talking about is a way to be able to attract more patients. Tell me more about this. We're talking about heart disease. So how does this all come together?
When a patient presents to the dental office and the dentist meets them and asks questions about what's going on in their life, I should say specifically about their disease conditions if they have them, it shows the patient that the dentist really cares about them on a personal level. That it's not just about solving a dental problem, a crown, a root canal, that sort of thing, but that they really care about the whole picture as far as the patient's well-being. And so in knowing how to approach a patient with heart disease, whether it be a heart attack or a past heart attack or advanced heart disease, more importantly, it's really important for us as dentists, to be able to ask the right questions, to communicate with the caregivers, and to understand those things so that we can treat them successfully and get a successful outcome.
Got it. So we're going to talk in the course about some communication skills around how to reach out or how to connect with our patients at this level. Do you also cover a deeper understanding of heart disease, or is there something we would learn more so that we know which questions to ask?
Yeah, precisely. So I will provide a very thorough background on heart disease at all levels. Obviously, the more time I have in a presentation, the more topics I can cover in heart disease. But I can tell you that congestive heart failure, which is what I have, is misunderstood. It's very complex, but there are certain questions that the dentist can ask of the patient and also communicate with their physicians and the caregivers to allow the dentist to treat the patient in a way that will be, again, lend towards successful outcomes. And by that, I mean, if you know, for example, what medications a patient is on, like a blood thinner, for example, you might know what it is where your limitations are as far as a procedure goes. Can I extract 10 teeth? Can I extract 2 teeth? What are my limitations? What are the parameters within which I can work? And those are the kind of questions I can answer and the problems I can solve.
That's awesome. And we know today in dentistry that there is a connection, between the mouth and what happens in the mouth and the rest of the body, and especially the heart. So I think this is a really relevant topic, and one that I know we've seen a lot of interest at different meetings on this type of a topic. So what would be really unique and different, do you feel, about your presentation in this arena?
Um, because I'm a heart failure patient, I can share with my audiences some of the things I went through as a patient, which strengthened my understanding of what it means to be a good doctor. Um, I've been through the gamut. I've been through 5 different hospitals in 22 years. And there is a spectrum of the type of care that you get, based on pretty much the philosophy that the hospital has. And so the more progressive hospitals now are going back, believe it or not, to philosophies that were established at the Mayo Clinic, which, funny enough, was established in the late 1800s. But it's a patient-centered approach. No procedures are done for monetary reasons. It's not about how many tests we can do or how many procedures we can do. It's a patient-centered approach where every specialty is looking at the patient and understanding and helping to support the disease process that the patient has. And that goes for communication as well. There's no hierarchy in the better systems. All the doctors that come to you seem to be on the same team, and they all seem to be on your team. And that's what we're going towards in medicine now. So it's a collaborative process and an informative process.
Yeah, that's awesome. Absolutely. Could you share this a little bit more about the format of this program? Is it? I believe I saw that it was anywhere from a short, like even a study club format versus even a full day. Is that?
The shortest program I've given so far is 6 minutes.
Oh. Or like this.
But usually it's not unusual for me to present for 15 minutes, and we can get a lot accomplished in 15 minutes. But of course, given that dental CE courses can go for 6 or 7 hours, I have a program that can go full day, even 2 days on this topic. So again, of course, we're going to focus on what we can fit into the amount of time that we're allotted for that program. But it's always going to have a little bit about my patient experience, which makes it unique. And it gives the doctors, our doctors, a certain amount of perspective that they might not have had from other more objective types of courses. I'm telling stories. I'm telling my story, but I'm not telling my story to talk about me. I'm telling the story because my story can be anybody's story. It can be the story of one of your patients. It could be the story of a spouse, a child, and it could be your story as a dentist.
Yeah.
And that's why it's different and unique.
I love that. And then on top of it, as a reminder, I mean, you do have, over 3 decades of experience as a dentist. And so you understand our world. So this is awesome. I really want to encourage the meeting planner who will be watching this video to reach out to you to get a chance to chat with you, to talk about how you could craft something really customized and wonderful for their meeting. Now, before we wrap up, Gary, is there anything we haven't covered that that you would want to share with the meeting planner before we go?
Beyond the fact that I love to share the lessons that I've learned through my journey, the messages that I hope to provide have never been more important than during this time of COVID-19. This pandemic has created a situation where we must continue to do everything we can to keep our patients safe and healthy. And so to that, I'm happy to present in person when we're able to again, of course, and certainly recorded online or live online, which is very exciting now, Zoom presentations such as this. It's exciting. We can communicate in a way that we haven't before. And I'm ready for it. I've done a lot of Zoom presentations with National Speakers Association already. I've gone through all the problems with this new technology, and it's actually challenges. It's not really problems. So we've overcome those, and we've come together really nicely with our audiences. So I look forward to those presentations.
Awesome. Well, thank you. Thank you so much for being here with me, Gary. And for the event planner who would like to find out more information, you can visit dentalspeakersbureau.com, and in our list of members, you can find Dr. Gary Sherman there alphabetically, or you can just put his name in and search, or you could reach out to me, Vanessa, at info at dental speaker. I've got like 12 emails. I have to think which one. Info at dentalspeakersbureau.com. So there you have it. Thanks again for tuning in. And until next time, be well.
Bye.